Welcome to the HealthAIbrief, breaking down the AI shaping our world one concept at a time. A lot of us will have had that moment of frustration. A patient's transferred to our ward or clinic and we're told that the recent CT scan that they had is on a CD-ROM. Or if you're trying to integrate a new piece of monitoring equipment and it just won't talk to our electronic healthcare record. Why, in an age of instant global communication, does getting different medical systems to share information feel so difficult? The answer lies in the languages that they speak. For systems to connect, they need a shared, rigidly defined language or a standard. Today we're talking about the three most important ones you may come across: DICOM, HL7 and FHIR. So let's first talk about images. The standard here is DICOM. Think of a DICOM file not just as a JPEG of a chest X-ray, but as a detailed courier package. The image itself is the content inside the box, but crucially the package also has an extensive shipping label attached. This is what we call metadata. It includes the patient's name, ID, date of the scan, the make and model of the scanner, the exact radiation dose, the slice thickness. This structure is essential for both the diagnosis and for training of AI because it needs to know that content. And DICOM is the unequivocal kind of universal language for medical imaging. Next is the workhorse for most other types of data, HL7 version 2. This is the standard that for decades has handled admissions and discharges, lab results, clinical notes. And the best way to think of HL7 is as a kind of digital fax machine. It's old, the format's largely a bit clunky and hard to read, but it's utterly reliable and everywhere. It sends fixed, complete messages like a whole page from one system to another. It gets the job done, but it's not particularly flexible. And this lack of flexibility is what led to the new modern standard, something called FHIR, which is an acronym FHIR, which stands for Fast Healthcare Interoperability Resources. And so if HL7 is a fax machine, FHIR is like a modern smartphone app. It uses the same secure web technologies that powered online banking and social media. But instead of sending whole rigid documents, FHIR allows for applications to make very specific targeted requests, like get me this patient's last 3 potassium results, or just give me their current allergy list. This makes it far more efficient and flexible for developers to build tools that can securely pull the exact pieces of information that they need from a healthcare record. So FHIR is the language of the future. When you hear about new apps that can integrate with a hospital's EHR or patient-facing tools that pull up their own results, it's almost certainly FHIR that's making it possible. It's the key to breaking down the data silos between our different systems, enabling a more connected and responsive healthcare ecosystem. And finally, it explains some of the friction that we feel every day. The reason that we still struggle with interoperability is that most of our core hospital systems were built around that old fax machine model of HL7, and upgrading that deep-rooted infrastructure is a slow and difficult process, particularly when you're trying to do it, with a 24-hour healthcare system that can't fail at any point. It needs to be up and running consistently while any updates are added. Understanding these standards helps us see not just the problem but also the path forward. So that's DICOM, HL7 and FHIR in a nutshell. If you found this useful, don't forget to hit subscribe or follow in your podcast app so you don't miss future episodes.